So I've done 30 seconds of centering. Hi, Carolyn. My name is Keisha Macias, and the patient I am seeing today is Abigail Macias. She is a 26-year-old Mexican female who has no current medical concerns. I'm going to be performing a physical assessment on Abigail, and I recommend taking vital signs PRN and monitoring for health status. So I'm going to begin.
Come in.
I'm gonna close the curtain for privacy. I'm gonna do hand hygiene. Hi, my name is Keisha. I will be your student nurse today. How are you?
I'm doing well. How about yourself?
Good. I'm just gonna ask you to confirm your name and date of birth.
Abigail Macias, August 25th, 93.
Perfect. And do you have any allergies, Abigail?
Not that I'm aware of.
No? Okay. And so what brings you in today?
I think just a checkup.
Yeah. Do you know what that entails?
I don't know.
It just involves going over some important systems in your body. So checking your eyes, listening to your heart and lungs, checking for strength in your legs and arms as well. Does that sound okay?
Sounds great.
Okay, so I'm going to begin by asking you a few questions.
Perfect.
I'm just going to ask, why are you here today?
Just a checkup.
Okay, and where are you?
In the clinic.
Okay, and what year is it?
2020.
Perfect. You are oriented ×4. Okay, and now I'm just going to do, take your vital signs. And so I'm just going to clean my stethoscope for you. I'm just going to first do temperature. So if you can place this under your tongue. Perfect. 98.6. Let me just write that down. Okay. And then have you gotten your blood pressure done before?
I have, yes.
You have. Perfect. Do you know what your normal blood pressure is?
No.
No problem. Have you had any surgeries?
I have not.
And which arm would you prefer?
On my right.
Okay. Excuse me. Is your day going okay today?
Yeah. Been
Good.
busy and luckily not a long wait out in the waiting
Sounds
area,
good.
which is nice.
Okay. Just gonna have you uncross your legs, relax your arm. Okay, I'm just gonna set this here really quick. Okay, if you can relax your arm for me. Perfect. So it was 110/72, which is really healthy. Perfect. Let me just jot that down really quick too. Okay, and now I'm just gonna take your pulse. This checks, well, I will check your pulse, but this one is oxygen saturation, so it checks the amount of oxygen running through your blood. And since you're a new patient, I'm going to check your pulse for 1 minute, okay?
Sounds good.
Perfect. So it's 64, and your respiration was 16. And then your oxygen saturation was 98. And these are within normal limits, so there's no need to be concerned about anything. Okay, and so now I'm just gonna ask, are you currently in any pain?
Just a little bit in my ankle.
And on a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain ever, how would you rate it?
Probably like a 2.
2? Okay. And so when did this first begin?
Just when I started running about 6 months ago.
Okay.
Yeah, just new activity.
And you said it was in your ankle. Which ankle?
My right one.
Right ankle. And is it a pain that comes and goes? Like, does it just occur whenever you run, or is it constant?
Just whenever I run.
Okay.
Afterwards, yeah.
And then do you notice it traveling up to your knee or your calf, or does it stay, do you think, in one area?
Just pretty localized to my ankle.
And how do you generally treat the pain?
Ice it and some Tylenol occasionally.
Okay. And then let me just make a little note so the physician knows, and we can come up with a plan for you so you're at a 0 and no longer 2 in pain. Okay. Okay, and then next I'm just gonna do the neurology assessment. So I'm just gonna ask you a couple questions. Have you experienced any vision changes?
No.
No. Do you wear contacts or glasses?
I do wear one contact, yeah.
And then which eye is which eye do you wear the contact?
Left.
Left
eye. Yeah.
Okay. And do you experience any tingling or headaches? No? Okay, so next I'm just gonna do a eye assessment on you, and this is just gonna it's gonna test the way your pupil reacts to light and how it accommodates. Okay?
Okay.
And I'm also gonna check for the roundness. Okay, so I'm gonna first have you follow this pen light, and just with your eyes, make sure you don't move your head along with it, but just follow it with your eyes, okay? And this is called the 6 cardinal gaze.
Okay.
Perfect. And now I'm going to do another little assessment. It's called accommodation. I'm going to have you follow the pen light again with just your eyes, and make sure you don't move your head. Perfect. You did really well. And now I'm going to do the light test. So I'm going to have you cover one eye and make sure your hand does not touch your face, but you just have it covered, okay? I'm going to come in with the light. Perfect. And I'm going to do the other eye. Perfect. Did exactly what I wanted it to, so your eyes were round, reactive to light, and accommodated. So now I'm just going to inspect your neck. Okay. Perfect. And I don't notice any edema, so no extra fluid in there. And I'm just going to ask you a question about your hearing. Do you normally hear a loud ringing ever? Have you experienced any hearing changes?
No.
Hearing loss? No.
Mm-hmm.
And then when was the last time you went to the dentist?
I've got cavities filled before Christmas.
Okay, so within a good amount of time.
Yeah.
And do you experience any hair loss or dandruff?
No.
No? Okay. Perfect. Just gonna set this pen light aside really quick. Okay. That's really good. And now I'm just gonna be listening to your heart. Let me clean my stethoscope one more time. So, do you suffer from any chest pains, or do you have a family history of a heart condition?
No, not at all.
Perfect. Okay. So I'm gonna go in. I'm gonna feel for the sternal notch, and then go 2 intercostal spaces down. I'm gonna go to the right. This is the aorta valve. That sounds really good. Now I'm gonna go to the sternal notch, go 2 spaces down, into the second intercostal space to the left, next to the sternal border, and here for the pulmonic valve. That sounds really good. I'm gonna pass Erb's point and go to the tricuspid valve, and that's the 4th intercostal space next to the sternal border. That's nice and strong. Sounds good. Now I'm gonna go to the mid-clavicular line, go in the middle, and then go to the fifth intercostal space to the apical pulse. And I would be listening to this for 1 minute since you're my new patient. And all of that is sounding really well. I don't hear any murmurs. Perfect. I'm gonna just write a little note to myself. Okay. And next I'm just gonna listen to your lungs. With that being said, I'm just gonna ask, do you have any breathing problems?
No.
Asthma?
No.
And is there any condition, like lung conditions in your family that I should be aware of?
No, not that I know.
No, and you don't smoke or?
No.
Okay.
No smoking.
So, I'm gonna start by listening up here, going back and forth. I'm gonna have you take a couple deep breaths and just make sure that you don't have to breathe out of your mouth, just make sure they're deep breaths, okay? That's sounding really good. I don't hear any crackles or wheezes. Perfect. Sounds really good. Perfect. All lobes sound really good in the front. Now I'm just gonna check the back. So I'm just gonna ask you to move forward a little bit. Thank you. I'm gonna move your hair off to the side. And I'm gonna start from the top and go front, go back and forth. All of this is sounding really good. And since I'm back here, I'm just gonna inspect your skin. Okay, have you noticed any skin changes? No, everything looks really good. And I don't see any masses or lesions or moles. So I'm just gonna write a little note to myself. Perfect. And I'm just gonna have you lay down because next I'm gonna be assessing your abdomen. Do you need help?
Oh no.
No?
Thank you.
Okay. And do you have any stomach pains ever? Do you experience stomach pains?
Not pains. I experience constipation occasionally.
And when did you notice this first occurred?
I've just kind of always had it.
Okay. No problem. And so you've always kind of had it? Okay, I'm just gonna write a little note to myself. And whenever you are constipated, is it pretty painful? Does it hurt to poop or?
No. I just every couple days it just won't go.
Okay. Yeah, maybe we can increase your fiber and water intake. We'll kind of evaluate that. But I'll definitely run this by the physician. So I'm just gonna write a note about constipation. And when was your last menstrual cycle?
Last week.
Last week. Perfect. I'm gonna write that too. Perfect. And now I'm just gonna inspect. I'm gonna inspect the contour. The contour looks really good. I don't see any lesions or masses. And then I would auscultate next, which means listening to all of your quadrants in your stomach. And then lastly, I'm gonna palpate. Okay. So I'm gonna clean my stethoscope one more time. I'm gonna start at so I've inspected already. I'm gonna start at the right lower quadrant and I'm gonna hear for any hyper or hypoactive sounds. Everything is sounding very normal. And I'm starting at the right lower quadrant, making my way up to the right upper quadrant, and then the left upper quadrant. And then the left lower quadrant. Perfect. Now I'm gonna palpate, and this is a light palpate. I'm just gonna go a couple inches in, maybe 2 inches. And I'm just gonna start at the right lower quadrant and make my way up to the right upper quadrant and then make my way to the left upper quadrant and then make my way to the left lower quadrant. And I'm feeling for any tenderness or masses. And are you feeling any pain currently?
No.
No? Okay. And I can't remember, when was the last time you had your bowel movement?
The day before last.
The day
so
before
2 days,
last,
yeah.
2 days ago. Okay. Just gonna write a little note. Perfect. Okay. And then now I'm gonna just have you sit up really quick, and then I'm going to examine your arms. Okay. And then since I just palpated your stomach, I'm going to do hand hygiene again. Okay. And now I'm just gonna check that your pulse is bilaterally equal in your radial, at your radial site. And that's very strong and good. And now I'm just gonna have you do the strength test. So I'm gonna have you grip your hands onto my fingers and tighten it as hard as you can. Okay, that's really good. And I'm gonna have you extend your hands out or your arms out and then press down against my arms and then press up against mine. That's really good. And then I'm gonna do the shoulder shrug. So I'm gonna have you shrug up while I push down. Okay, that's all really good. And now I'm gonna inspect for capillary refill, which just tells me how your blood is perfusing throughout your body. And that's less than 3 seconds, so that's really good as well. And then I'm gonna check for clubbing, which just means extra fluid in your fingers. So I'm gonna have you press your fingers against each other. Okay, that looks really good. And I'm assessing for skin color, hair growth. All of that looks really good. And do you experience any arm pain?
No.
No? And then I'm just gonna do a range of motion. So I'm gonna see, does this hurt?
No. That's good.
No? I'm gonna check your other arm. And that doesn't hurt?
No.
Perfect. And you don't experience arm pain?
No.
Okay, let me just write this down. So your arms look good, they look healthy and hydrated. And now next I'm gonna do your leg assessment. Okay. So I'm just gonna ask that you take off your socks, please.
First.
Okay, and then I'm gonna check for edema in your legs. So both your legs. Okay, that looks really good. And now I'm gonna check for capillary refill. Okay, and then the refill is really good, which just means that your blood is perfusing to your extremities, which is good. And now I'm gonna have you do the strength test. So, well, actually, since I'm down here, I'm just gonna assess for hair growth. It looks good. Color looks great. Okay, and then I'm gonna have you do, I'm just gonna check for your dorsalis pedis pulse and make sure that your blood is reaching down here too. Yep, and I feel it, and that's great. I'm just gonna check in this leg. Yep, that feels great. Okay, and so I'm gonna do the strength test. So I'm gonna have you press down against my arms, press up against my arms. Perfect. And I'm gonna do that range of motion that we talked about again. So I'm gonna have you move up. And do you experience any leg pain? Does this feel okay?
Yeah.
Perfect. And so the range of motion is great. The color looks great. It's nice and hydrated. Okay, and you can put your socks back on if you'd like. Okay, and so I'm gonna just do hand hygiene since I was just touching your feet. So the last thing I'm gonna have you do is do a gait. So I'm gonna have you walk down and check. Okay, your gait is great. Perfect. Do you have any last questions for me?
No, I'm okay.
Perfect. So I'm just gonna go over the constipation and your leg pain or your ankle pain, okay? I'm gonna make sure my patient's in a nice comfortable position. The call light is right here if you need anything. It was really nice meeting you.
Nice to meet you.
And I hope I see you soon, okay?
Okay, thank you.
And then I'm gonna do hand hygiene and then close the curtain for privacy.